So today, what I'm going to do is start out with just trying to help you understand how the bladder works, and then how it doesn't work right. The bladder is a very unique structure. It has only two functions: storing and emptying, right? Okay. The way that happens is the bladder goes from a small structure to a fairly large structure over time. And most of the time, when it becomes large, we have certain feelings. And those feelings are, gotta go. The muscles of the bladder, when it's working normally, are controlled by the central nervous system. And the bladder that is storing properly has a unique characteristic. It's called compliance. Compliance means that unlike that balloon, the bladder can get large without generating pressure. Why? Because the muscle bundles slide one over another until it gets to a certain point, and then the nerves that supply the bladder send a signal to the central nervous system that it says, we better do something about this. You say, okay, bladder, contract. And now the bladder contracts in a meaningful fashion until it empties. If you walk out of this room with just those concepts in mind, you've learned more about incontinence than most people know. We could stop right now and you have learned a lot. So what we're really talking about today is the position of the bladder, the way the muscles work that store or empty urine, and one last point, and that is this structure, which is the muscle that brings the tube together, and we call that the sphincter, or the shutoff valve. What are we talking about? In this case, we're going to focus on the female pelvis, and we're going to focus on the problem of pelvic floor relaxation and the bladder falling. But we'll also tell you that there's ways to fix this that are revolutionary compared to the way it used to be. Here is the normal bladder on an MRI. Here is the pelvic floor. It runs between the sacrum and the pubic bone. And here's the bladder in normal position. What's a cystocele? Well, a cystocele is a hernia of the bladder, meaning that the bladder has fallen through the pelvic floor to some degree. So if you look at the vaginal approach to trying to make a diagnosis, you see a bulge. If we're going to repair a cystocele surgically, we approach it this way, and it's nice to know what's inside this bulge. This is a significant cystocele where the pelvic floor is given away and the bladder is actually fallen outside the abdominal cavity. But they leak urine because the pressure here is much higher than the pressure out here. And when you cough, the pressure here is high, the pressure here is low, and you lose urine, and that's called stress incontinence. Rectocele. What's a rectocele? This is the rectum, here's the bladder, rectum behind. This is normal MRI anatomy. Here's the rectum where it's lost support and it's actually fallen again. And here the rectum has moved out of that abdominal space and it's pushing the content of the vagina forward. The rectum, the colon kink, and you have to push the rectum back so you can have the stool move forward. So let's talk about the anatomy of this. First off, why do women tend to have this problem? It's very simple. You have the blessed gift of childbearing. And during pregnancy, as the fetus develops and the head moves down into the birth canal, pressures are exerted on these very muscles we're going to talk about. And when you can only press a muscle so long before the blood supply is is compromised and the muscle stops working the way it normally did. There's nerves there that make these muscles contract. Those nerves are affected. This happens. The organs fall through this opening. And now you begin to have, for instance, in this case, the bladder outside of the abdominal cavity. So now we're going to focus on incontinence. And the message here is, it's very common, very common. 44 million women, whether they'll tell you about it or not, have wet pants. Here's avoiding diarrhea. And I'm going to tell you that most of the time, the physicians that'll be most in tune with this are urologists. When you sneeze or cough or strain, you put pressure on your bladder, and if your bladder is improperly supported, you go back to that squirt gun effect. The pelvic muscles that hold this up aren't doing their job. But most of those 44 million women have had 2 or more children, and that's where this problem of not being able to support the bladder appropriately and the stress incontinence has its origin. So once again, we go from the appropriately positioned bladder to the bladder that's fallen below the support line, and we have an element of squirt gun. What are we going to do about this? We're going to use something to repair the hernia. So what do? We devised a sling. It can repair the anterior wall weakness. It can even repair the posterior wall weakness. And we're going to touch on all of those things. Now this is a further sophistication of that principle. Putting a mesh in takes a certain element of surgical manipulation. Putting a mini mesh in takes less surgical manipulation. That's good. Minimally invasive treatment. So in essence, with one small incision, one needle, and one very small mesh, we can essentially support the urethra and bladder, and there's no big incisions. There's no significant stay in any institution. The procedure can be done easily within an hour, and you can be out the door at home. So you don't have to suffer from incontinence. There are many treatments available, and you can quickly get back to a normal existence. The minimally invasive approach to fixing the pelvis is really going to change all that. Now, this is called the Perigee system, American Medical Systems, who's helped us a lot. So here's the bladder. Here's the support system now under the bladder, holding it where it belongs. And that is the anterior repair. Safe. Taking a big operation, made a small operation, and designed to restore normal anatomy. Apogee. The apogee is to hold the rectum in place. It's very similar to the perigee. Again, it takes a big operation, makes it a small operation. And in this case, here's the rectal area, and here's the bladder is up here. You can't see it because it's not illustrated. But this polypropylene support system has been placed to reinforce the muscles that hold the rectum in the area of the pelvis where it belongs. So as you look at it, here's the rectum, here's the bladder. Now the rectum is being pulled back, and the cardinal ligaments are what's the anatomical structure that's weakened, and this essentially replaces it.